thank you for joining us with Hope with Answers. My name is Gina Hollenbeck. I'm a stage 4 lung cancer patient and the president of Out Positive, and I am here with the very beautiful Dr. Natasha Leighl.
Thank you so much. I'm delighted to be here, and I want to congratulate you on all the great work you've done so far.
Thanks so much. Well, we wanted to talk about the patient voice a little bit. You know, I am so excited, but everywhere I'm hearing that patients matter, that the patient's voice matters, and doctors are paying attention to, like, why do I even do this? The patients matter. And so I wanted to just kind of dive into that a little bit and see how do the patient's voices matter?
So it's really been a great history over the last 20 years. When I started in lung cancer, we were very jealous of the breast cancer community because the patient voice really mattered. It drove treatment options. You know, we really saw advances based on what patients wanted and needed. But in lung cancer, you know, we were so far behind in getting great outcomes. We desperately needed the patient voice, but it was very soft because we just weren't doing a good enough job. And so it's been really wonderful over the last 2 decades to discover all of these different types of lung cancer, to have targeted therapy. And now we've got an amazing elevation of the patient voice. We've got the ALK group, we've got the Ross Wonders, we've got the EGFR persisters. There are international groups. In my country, we have Lung Cancer Canada. So it's really been wonderful to see the volume turned up so much with the patient voice. And I think, you know, it's very easy in clinic to get caught up in the day-to-day and not remember to put the patients first because you're so busy worrying about all the systems and all the things you need to do. And if you put the patients first, everything does seem to fall into place. It's also been really nice to see, wonderful actually, to see the work you have done, you and your colleagues have done in shaping research. You know, historically, start with discovering a target, preclinical studies, some clinical studies. Drug development would take 15 to 20 years. And what I love about what you've done is you've reminded us, nobody has 15 or 20 years here. Let's get going. Let's get some results. We need some high impact research that we can get results from that will help us now. And I really love the way you've refocused us on what's important and what really needs to be motivating us and driving us.
Thanks so much. Yeah, there's definitely a sense of urgency for us as patients. And I appreciate you too. When I came in, I feel like you're kind of a rock star because you do put the patients first and you do listen to the patient voice. So that's so exciting to me that you also got the ASCO 2019 Excellence in Teaching Award, which means that you're teaching other doctors to do that. So
Thank you.
tell me about that. How does that describe your work? Like, what does that even mean?
Thank you so much. I've never thought of myself as a great teacher. One of my students, I actually learn far more from the people that I'm supposed to be teaching than I think I actually teach them. But someone said to me that what they learn most is the way I am in clinic, my relationship with my patients, that idea of putting patients first, that going that extra mile because you care about your patients, and really trying to incorporate the patient voice, empowering people, working with advocacy groups, you know, really recognizing that volume needs to be turned up. And so if I can pass that passion for patients with lung cancer on to the next generation, then, you know, my work is done. And it's amazing, you know, when I first started, there was only a small number of people interested in lung cancer, you know, a really stalwart, dedicated community.
Why would you be involved? Why would you? There's a lot of people dying in lung cancer, right?
And we needed to change that. And
Yeah.
so what's great now is that it's so exciting and the patient voice is so amplified that now, you know, I was at a meeting last night and the breast cancer docs said, you know, we're a little jealous of lung cancer. We feel like we're behind lung cancer. And so that was really extraordinary when you look at precision medicine and immunotherapy, you know, for us to have made so much progress that other people sort of look at us and say, look what's happening in lung cancer. And the reason why that's great is because that translates to progress for you. And then if we pass that excitement on to the people that are coming through, make sure that they understand how important it is to talk to patients, find out what patients really need, and then that way they can develop their research careers really focusing on what patients need.
And then everybody wins, right? Oh, thank you so much. I'm Gina Hollenbeck, and this is Dr. Leighl, and we are here with Hope with Answers, and thanks so much.
Thank you.